It's a really good interview. I'd recommend that you guys listen to the full 3 hours plus. It's really engaging conversation. And
yeah, even if you think you don't like Joe Rogan, this is a great conversation if you like politics and if you want to understand where the people in the
and the whole thing is on Spotify. It's 3 hours long. We pulled a clip of this great debate they had over Medicare for All, which is a good example of what I was talking about, where you actually get to see a lefty like Kyle perform under some pressure, when confronted by these talking points, essentially from someone that's maybe not 100% indoctrinated, someone that's not also a Bernie bro, et cetera, et cetera. But yeah, this was a really good clip. And generally I thought Kyle did pretty well, but we can take a look and you guys can judge for yourself.
But there was a study from the University of Massachusetts Amherst which found that Medicare for All saves $5 trillion.
That place is the biggest lefty propaganda spot.
Well, it was a study based on comparing world systems.
That is a socialist hellhole.
If you want to look at the study,
I shouldn't say hellhole, but it's not. It's just like even in the 80s, when I was doing stand-up and I would go to Amherst, I was like, this place is crazy.
I'm not defending the college campus.
It's a great area.
Just to be fair.
Like, it's a great area.
I probably would agree with you on how dumb the college kids are there. In terms of the academic study coming out of there, I'm pretty sure, because think about it, Joe, the way the system works now, you have a giant rapacious for-profit middleman they're just a mafia in between you and your doctor, and they take their cut. Right. The whole idea of Medicare for All is just get rid of the mafia. There is no middleman. There is no cut going to a middleman anymore.
Right, but it's more complicated than that, right? Just the idea of paying doctors like that. Can doctors still charge what they would like to charge, or should we put a cap on what they charge? Should we treat it like a free market thing, like we treat anything else? Like if you went to a tattoo artist, some tattoo artists will charge this much. Some like, should we treat doctors in a different way than any other thing, because it's an essential service for people?
So just think of it like this: the way it would work is the way it works for firemen or cops. It's the same thing. That's all it is. So the real question is, where is the funding source coming from?
But here's the problem with that. It doesn't work like that in the private sector. Like the way it is now, it doesn't work like that.
That's right. It doesn't work like that now.
Right.
That's correct. Yes.
Why would doctors have an incentive to become an orthopedic surgeon if they're going to get paid specifically the way firemen or cops do? Well, they wouldn't. So you wouldn't get the best kind of surgery. The kind of surgery you get when you go.
I have a feeling, by the way, that if Joe Rogan's house caught on fire, the firemen would come put it out. Just going to put that out there.
Yeah, and I also just think that there's multiple examples, and we can talk about this in greater length after this wraps, of countries that do not prioritize socialized medicine, that have medical breakthroughs, discoveries, because they have adequate funding to do so. But anyway, we can finish the clip.
Go to a real expert, a guy who works on the Lakers or something like that. Guy's some fucking wizard at reattaching ACLs. That guy needs incentive to become who he is. Like those super ambitious doctors that are the top of the food chain, those are the ones that people seek out. Would that guy be able to still charge a lot of fucking money for those surgeries? And that is one of the reasons why they're so good at it in the first place, is because that guy can have a Ferrari and live in a big house in Beverly Hills. And this has always been the system. That's the reason why people come. I have friends from Canada that will come to the United States for surgery and pay for it out of their pocket because they want to get better doctors, more incentivized doctors.
It's also true that it works the other way though as well. Remember when Rand Paul went to Canada to get some surgery, and this is a guy who's notorious for blasting, their socialized medicine system. I mean, listen.
He went to
Rand Paul went to Canada to get some sort of procedure, some sort of medical procedure, and of course everybody was like, that's
right.
Massive
but Rand Paul is also a doctor, and he probably knew that this one guy up there was a specialist in one particular thing.
But that's the exact counter to the point you just made.
Not necessarily. It's usually the exception to the rule, because more people are coming from Canada to the United States to get surgery than are going from the United States to Canada. It might be just an aberration or an outlier.
So is it?
Let's find out.
I'm just asking you: is it your contention that Norway, Denmark, Iceland, Sweden, Australia, Canada, all these places that have universal healthcare systems, that they don't have the same level of high quality surgeons and whatever that we have here?
I have talked to doctors who say that's the case. I've talked to doctors who say that the system is not perfect, that it's deeply flawed, and that greed and corruption are a gigantic part of it. However, the most innovative and most skilled surgeons and doctors are in the United States.
So again, just because he brought up this example of like the firefighters and the cops and stuff, which again works pretty well for everyone. I think it's safe to say if your house is on fire, the firefighters are going to do everything in their power to put out the fire. But according to Joe's analogy, the richer you are, the better fire care you should be able to get. Like, if your house is on fire and you're a Laker, then you should be able to call a special number, and 3 times as many fire trucks will come with 3 times as much water to put out your house in 5 minutes, versus the poor people, if they only have like $5 and a shitty insurance plan, then hopefully the fire truck gets there in time.
Then the prisoners come and take out their fire.
Exactly. So it's like, I think he would agree that both are essential services, a fire department and healthcare. If you're in an emergency, you're in an emergency. But it's interesting how he seemingly can't put together how both systems should be, funded the same, how both could be, operated in the same kind of way that's equal for everyone, not just making it so that the richest among us, the Lakers, can get the quality care while everyone else is stuck in the shitty system.
Yeah, and I think he gets stuck in this weird talking point where he wants to be like, well, the percentage of people who come from, the United States or go to Canada, it's like, that's so ridiculous because no working class people from Canada come to the United States, right? No, like you're talking about, like, let's say maybe 50,000 people in Canada that can afford to come down to the United States. Like, are we going to really base our entire medical system over, we want to make sure that those, 50,000 Canadians and 100,000 Americans that are the richest and most opulent among us can have the best, most premium, outrageous fucking care, while the bottom, 100 million get left to, have what's the equivalent of what he suggests here, which is coming up here, which is like a public attorney, which anybody who knows anything about the law knows you're getting the fucking shaft if you have a public attorney. They're too busy. They're going to try to force you to take a plea, even if you didn't do it. Ask any of the hundreds of thousands of individuals who have been locked up because of plea deals that they've taken because they had a public offender. Or defender, sorry. Not an offender. They should be offenders. But anyway, slip there. Yeah.
And again, it's a crazy idea apparently for some of us, but if we had a system that was truly equal when it comes to healthcare, where Joe Rogan had to go to the same healthcare provider in the same place to get his healthcare that anybody else did, I think we can all agree that system would end up working really well because millionaires and billionaires, people like Joe Rogan, would demand that it works well. They have a lot more power in this society than the poor people. And if the healthcare system is garbage, then they're going to make sure that it's not that way anymore. So if everyone has to operate on the same terms, then it ultimately equals a level playing field where everyone can get decent insurance, where everyone can have their life saved in an event of an emergency.
Yeah, 100%. And that's the fundamental thing here is like, what's your perspective on this issue? Are you going to prioritize making sure that every single person in this country gets really good healthcare, or are you going to get hung up on the fact that the 1%ers can't get as good of healthcare? It's kind of like, oh, if I pay more taxes, I'm going to have less money. Okay, but you still have plenty of money. It's getting hung up on the fact that you have less. Like, it's a matter of like glass half empty, glass half full, kind of what's your outlook on society, I think. And Joe is, admittedly, where a lot of Americans still are, where they think that, something tragic is going to happen, where we're going to just have the worst medical system ever if we take the profit motive out. But it's kind of like, Joe, do you think that our firemen are shitty? Do people not sign up to be firemen and dedicate their whole lives? I literally just had to go to a fucking, you're a terrible driver, like, here's how you don't get your license taken away program. And one of the guys that was actually interesting and wasn't just like a simp cop that was talking to us about like, weed is terrible. This guy was a fireman, and he was talking about all the like horrifying shit that he'd seen throughout his life. This man dedicated his whole life, and he was like, all the guys at the station, he was like, these are guys that care about their community. They're the most community-based guys. He was like, and that's why people become firemen. And I feel like that's the drive that most people have to go into medicine. Like, nobody that I've ever talked to that was going to medical school, and we went to a college that had a healthy number of people that were pursuing degrees in medicine for a brief time, or at least I went there for a brief time. You did all 4 years at UMKC, Gavin. Those people were always talking about how like their specific interest in medicine drove them to that. Nobody was like, I can't wait to make $400,000 a year as a surgeon. It's like, one, it's really fucking hard to become a surgeon, guys. Like, you have to have a deep passion. You have to be willing to do so many things. Like, it has to transcend that. And I feel like those people's motivation, those people's drive exists beyond capital.
Oh, yeah.
It's just that we have a society condition people to believe that that's the only motivator.
Yeah, and guess what's a more dangerous job than being a surgeon? Being a fucking firefighter. That's one of the most intense jobs in the entire world. A job that you can very easily, lose your life doing in the effort to protect and save other human beings. And again, like, Joe doesn't seem to apply this logic to that line of work, to that public utility. It's not like, oh, we got to make sure every firefighter has a fucking Ferrari and a house in Beverly Hills to make sure that everyone is protected from fires. It's just crazy when you start to break down his line of logic.
Or one more example that I think is clear, and you and I are an example of it. Teachers, man, I had great teachers when I was growing up, and as much as they, I was a troublemaker in school, and I really learned a lot from the teachers that I had access to. And even in our district, which was probably one of the most well-funded school districts in the country, Gavin, we still had really crappy paid teachers. They did not make a lot of money. I think one of my teachers in high school told me that the equivalent for like a teacher with their master's degree is like $25 an hour. So that's not a financial incentive. And yet still so many people put their heart and soul into their career of teaching. And it's like, of course we should pay them more money. And I would support that.
Even medicine, think about, just because the doctor's making a shit ton of money, it's not like the nurse or like the RNA or whatever the fuck they're called.
EMT.
Yeah. It's not like those people are making like billions. It's not like they have Ferraris, but they're still doing work that's arguably just as important, that's saving just as many lives. So it really is all just a racket, and it's just another one of these instances where all the actual profit goes to the top, while people that are working just as hard, risking their lives, all that stuff, are getting shafted. So that's capitalism, though, and I don't understand how anyone could defend it. But let's take a little bit, more of a look at this interview and see where it goes.
Know if that's true, but I heard this from more than one doctor.
It's very possible that there's a reason why the Saudi princes come here when they want stuff done. Not contesting that at all. The part that people don't want to talk about, which is actually, I think, the way more important point, is that anywhere from 45,000 to 60,000 Americans die every single year because they don't have access to basic healthcare.
Yes, but these two things aren't mutually exclusive. We're talking about two different things. Like, just because someone has basic healthcare, isn't it possible to have both? Isn't it possible to have a system like you have public defenders, right? Everyone's entitled to a public defender.
But people want a private defender because the public defenders are overburdened and all that stuff. Again, the point I would make is that it's a funding issue. So if you were to pay those public defenders more and attract more talent, so in other words, can you craft a universal healthcare system where there's sufficient compensation for the experts that you're talking about?
Right.
I say absolutely. Because at the end of the day, it all comes down to funding, like you're saying. Yes, if you want high quality, you're gonna have to pay for that high quality.
Right.
So you should set up the system so that, I don't want doctors making next to no money or making less than what they would make under this system now. You want to have it so that you are incentivizing these people to stay here and treat here. And you absolutely can craft a system like that. And even if you do that, you end up saving money because there's just it's a fucking black hole here, Joe. Forget insurance companies who are, mafia criminals in their own respect. Hospitals as well are really fucking bad. I remember covering a story on my show at least 5 years ago where I went through line by line this medical bill that became, it blew up, it went viral, because they were price gouging for everything. They even had this line for cough suppressant aids, and they charged like $100 for it.
Cough drops?
No, you know what it was? A tissue.
What?
A tissue.
That's a cough suppressant aid?
Cough suppressant aid.
You should go to jail if you write that down.
But the funny thing is, all right, what do you look at here?
Rand Paul said he went to Canada for.
Okay. It chose Shouldes because it offers the surgery that he needed at the right price. The hospital specializes in hernia repair using natural tissue rather than artificial mesh. The Louisville Courier Journal reports that the procedure in Canada will cost an estimated $5,000 to $8,000. According to Healthcare Blue Book, a hernia repair in the United States will cost between $3,000 and $12,000, or up to $19,000 for a laparoscopic repair.
Read that next line because that's important right there.
Healthcare costs in the U.S. are also notoriously difficult to determine prior to procedure, and plenty of patients have received bills that can be thousands or tens of thousands of dollars over what they expected to pay.
That's to the point of not only are the insurance companies price gouging people, it's also the health care providers who are price gouging people. So really we have a scam within a scam on top of a scam in the U.S. healthcare system.
Another perk of going to Canada is that Shouldes offers a resort-like setting for recovering with fresh meals, an exercise program, on-site massage, and relaxing views.
So yeah, there's a pretty good place to stop, I think. But overall, I thought Kyle did a pretty good job there. Obviously, it's always a little bit tough to, argue your position on the spot, especially on a program that big with a platform that big and an audience that big. It can be a little bit overwhelming. But I certainly think that he did a pretty good job bringing up some good points and making a pretty solid defense for a universal healthcare system here in America.
Yeah, 100%. I think first, for somebody who wasn't trying to derail the conversation and just be like, fuck you, I'm like, of course, that's not the position he was going to take. Like, he educated Joe. He was extremely, polite, and he didn't embody the position of the irritating left winger that I think is a lot, more useful. You can be a lot more nitpicky about your criticisms and how you react to things if you're engaging with mostly other leftists. Like, shocker, people who watch The Vanguard are already on the left. Like, I don't have to make my sales pitch to somebody neutral when I'm talking. What I think that Kyle did a really good job of was providing tangible examples to the casual American. And what we've talked about time and time again on this show is through all of our disagreements with Joe, he's really good at talking, and he is really a bellwether for where the American people are at. And I think that the kind of talking points that Joe brought up are the kind of talking points that people bring up to me when I say, oh, dude, we need to get rid of the fucking healthcare system and nationalize it. And they're like, exactly. What are you talking about? And I'm like, no, dude, trust me, it's a good idea. Let me explain it to you. And that's exactly what he did.
Yeah, and it's kind of like that instant when you're talking to a normal person, and they bring up this point. It's kind of like when a normal person would argue against a more high, like increasing taxes on the rich. It's like you do realize that's not going to impact you, right? Like your average person is not going to be negatively impacted by the net raising of the 1%'s tax, or taxing the rich, or whatever you want to call it. In the same way, the arguments Joe are making here, they might apply to him, or like a Laker, like he said, like a fucking literal millionaire or billionaire. But to your average person, a universal healthcare system would massively, massively, massively increase their quality of care and their ability to get it. And I think that's proven by the fact that, sure, maybe a handful of the most opulent people from other countries, like the Saudi princes or whatever, will come here to get that special surgery or whatever. But take your average citizen in Canada or the UK or Australia or Denmark, Iceland, etc. Ask them if they would give up their healthcare for American-style private insurance, and I guarantee you 99.9% of those people will tell you, fuck no, that's insanity, and that our healthcare system is one of the most barbaric and insane in the entire world. It's really a laughingstock of the rest of the developed world. You'll go anywhere over there and they'll look at you like an absolute crazy person if you explain to them how our system operates, and the fact that depending on how much money you make, that's going to determine the quality of care, your access to it, and it potentially could put you in debt for the rest of your life. So it's just crazy again that this has to be continually explained to people. But as leftists that believe in this position, we do have to remember that not everyone is necessarily on the same page as us, that this is a somewhat foreign concept to many Americans,
and there's decades worth of propaganda.
There's decades worth of propaganda, and even if people are regurgitating some dumb talking points, oftentimes those people can be won over or convinced. They just need to have this concept explained to them, because it is, people are innately just kind of afraid of change, and especially when it comes to healthcare or something like that they have figured out, I mean, that's what routine,
the bedrock of conservative ideology.
Exactly. Right. And it is incumbent on us, though, as progressives, as leftists, to, explain how this transition would take place and why it would be beneficial, because there is all that propaganda out there. And of course, there are instances, too, of conservative governments, like currently the conservative government of Boris Johnson in the UK, which has, in addition to the previous conservative government, really defunded the NHS. And now people over here can point to that and say, well, look, if we do that, they're just going to chip away at the funding and make it shittier and shittier. There's that really great film that won the Palme d'Or called I, Daniel Blake, I believe, about this exact situation. It's actually a heartbreaking look at, even in the UK with the single payer system, how fucking bureaucratic and impossible it can be for a normal working person to just get the healthcare they need. That is a real problem, and one that we can't just pretend doesn't exist as leftists in America that are advocating for the system. We need to make sure that not only is the health insurance industry abolished, but that our Medicare for all or NHS style system is guaranteed as an unalienable right that cannot be chipped away by some fucking, future conservative president or some neoliberal that wants to, put that power back in the hands of corporate insurance companies. No, it needs to be a system that's set up permanently so that it can't be chipped away at. And that needs to be made obvious to people that may be unsure about this transition. Because again, there are examples you can point to of a public system being defunded, and that cannot happen under any circumstance here if we make that transition.